Hey, Professor Sokol, it's Taylor for my NG tube checkoff. So I will go ahead and get started. Hi, my name is Taylor. I'm going to be your student nurse for today. It looks like the doctor has ordered an NG tube for you, which is a tube that goes from your nostrils down to your stomach. Do you have any questions about the procedure today? Okay, perfect. Can you verify your name and date of birth for me? And how's your pain today on a scale of 0 to 10? Okay, and are you allergic to anything? Okay, perfect. So I'm going to go ahead and get my patient set up. I will raise the bed to hip level and lower the side rail that I'm working on. My patient will be sitting high Fowler's so I can assess him. Do you have any nasal surgeries, deviated septums, or broken nose that you can tell me about? Okay, perfect. So I'm going to go ahead and inspect patency of both nostrils. There's no problems with breathing out of each nostril, so both are patent. So I will tell my patient it looks like both of your nostrils are good for me to use. I will go ahead and use the right one since it's closer to me. Is that going to be okay? Okay, perfect. Let's see. So before I start, let me go over my supplies. I got my lube here. I have a safety pin and rubber band for securing. I've already cut my pieces of tape. This one will be to mark the length on the tubing, and I already have my pant tape here for securing it on the nasal bridge. I have a brand new syringe in its original packaging and a brand new tongue depressor in its original packaging. I got my Salem sump, my legend for my pH paper, my pH strip sitting here, emesis basin for the patient, and a cup of water with a straw for them. So I will go ahead and I'm going to go ahead and assess for gag reflex first. Can you open for me? And okay, so patient's gag reflex is working. And you can get the Salem sump ready. So I will be measuring from the nair to the ear to the xiphoid process. So on my patient, that is 55 centimeters. So I will go ahead and mark that with a piece of tape. This way I know how far the tube needs to be inserted and that we've gone far enough. Okay, I'll just set that in the basin. Go ahead and all right, so my patient can be clean during the procedure. Let me go ahead and unhook this. We'll use that for later. And I have my syringe all attached to there. Okay, perfect. So I'm going to go ahead and open up my lube. And we'll lubricate this really well for the patient. So I'm going to let the patient know that I'm going to start. I'm going to put my hand behind their head and have them tilt their head back. And this will be closer to them. And then I will go ahead and advance through the right nostril. And making sure my patient's able to tolerate it. Once we've advanced about 4 to 6 inches, I will actually go ahead and have my patient tuck their chin, and I will have them sip. And they will be holding their cup and continue sipping as I'm advancing. Continue sipping, and perfect. So I've reached my mark where my tape is. So I'm going to go ahead and secure that. I'm going to withdraw about 5 mLs from the syringe. That way we can check. I'm going to hold it upright like this so nothing's spilling out. I'm going to inject a little onto my pH paper and return that back. So it looks like my pH paper is orange. I'm going to match it to my legend here. So pH is 3. So I should be expecting anywhere between 3 to 4. So we're good there. I'm going to go ahead and inject the rest of the gastric contents back into the tube to return to the stomach. And withdraw. We put in about 20 mLs of air so that the line is clear. Perfect. And my patient is wiggling their neck a little bit. Go ahead and plug this back up and plug the top. Okay, perfect. Make sure my patient is comfortable. So that is in and that is closed. I'm also going to have them open their mouth, check to make sure none of the tubing is coiled. We're good there. So now I'm going to secure it to the bridge of their nose. So I have my pant tape here. Okay. So I'm putting to the bridge of the nose, and I'm going to take one of the pant legs and wrap it around. And take the other pant leg and wrap it around. Perfect. And I'm going to take my rubber band and safety pin. I'm going to wrap it around the tube. I want to make sure that my patient is still comfortable moving and turning their head. So make sure we give it some slack. But I'm going to be clipping it to their gown. Oopsies. Oh my goodness. I'm going to be clipping it to their gown like so. So that way there's enough room and people will be able to see that my patient has an NG tube. So I'm going to go ahead and clean my mess, raise my bedside rail up on this side, and I'm going to let them know that this patient needs to go down to X-ray to confirm placement of the NG tube before use. And that is that.